rising, change is coming, it's not surprising, relief is on its way. I believe it's here to stay.
Menopause. It happens to all of us. Our ovaries stop producing estrogen, and we stop having menstrual periods, which is actually what menopause means. So, it's going to happen. We have no choice. We're going to go through menopause. We do have choices, though, and they're very important choices about how we deal with menopause and the changes that accompany this phase of our lives. We can choose to make these the best years of our lives, a time of personal growth, satisfaction, and fulfillment, by taking the best possible care of our own health during this period and choosing to take estrogen replacement therapy as a way of replacing the estrogen our ovaries are no longer producing. Or we can choose to do none of these things. Either way, it's our choice, each of us individually. Welcome. I'm Dr. Nanette Santoro. In this video, we're going to talk about what the menopause experience is like, and we're going to talk about estrogen replacement therapy, or ERT, including its benefits and risks. We're also going to tell you about transdermal ERT, another way to take estrogen. We'll be focusing particularly on Climara estradiol transdermal system, once-a-week ERT. We'll show you how to apply the patch, and we'll talk about what you can expect from this choice of estrogen delivery. Finally, we're going to give you this information right from the experts, the real experts themselves. Not just from a physician like me, or from a nurse practitioner like Kathy Furness, but from women who, like you, are in or about to enter menopause. Before we go on, let's introduce the members of our group. First, meet our nurse practitioner, Kathy Furness, who specializes in working with women in menopause. She's also going through menopause herself, so she can talk as a patient and a practitioner. To her right are Norma Nicholson and Marcia Costa, surgical menopause patients, and Jane Fant and Pat Udo, who have experienced natural menopause. Thank you for being here today. Let's begin by talking about what menopause is and what the experience is like. Technically, the term menopause refers to the time of a woman's last menstrual period, which is followed by the time known as postmenopause. The hormonal changes that lead up to a natural or non-surgical menopause actually take place during a span of several years, usually beginning in our mid to late 40s, and they're a direct result of decreased production of the hormone estrogen. Estrogen, along with progesterone, are the major female hormones. Estrogen production markedly decreases when the ovaries finally run out of eggs and stop functioning fully. If you go through natural menopause, your body will stop producing estrogen slowly, and you'll probably have a gradual onset of the symptoms of estrogen deficiency: hot flashes, night sweats, headaches, vaginal dryness, and so on. If you're experiencing these symptoms, or if you have experienced them, you should know that you're not alone. Many menopausal women experience uncomfortable symptoms when going through menopause. Some women undergo a full or partial removal of the uterus, called a hysterectomy. This procedure will not bring on menopause if the ovaries are left in place. The ovaries will continue to produce estrogen. If, on the other hand, both ovaries are removed surgically, you'll experience what's known as surgical menopause. Your body will be deprived of sufficient estrogen all at once, and you'll experience the symptoms of menopause suddenly and possibly with greater intensity.
Norma, let's start with you. You went through surgical menopause about 11 years ago. Can you tell us what that was like for you?
Sure can. Well, it started out with those crazy hot flashes. They were driving me insane. They were intolerable. I wasn't able to sleep, and because I couldn't sleep, when I woke up, I was very irritable. I was going crazy. So I knew at this point I had to control these hot flashes.
My experience was different because I had a hysterectomy on August 25th, and by September 1st I was on ERT. I couldn't have planned it better if I tried. So from the very beginning, I had absolutely no symptoms.
Both of those are actually pretty common experiences with surgical menopause. The experience of natural menopause is similar in some ways, but different in others. Jane, can you tell us what it was like for you?
Yes, well, first I started to notice that my period was no longer regular. And then I realized I was starting to not sleep through the night. I'd wake up and be throwing off the blankets and hot. And then I realized I was also having some mood swings more than normal. And everyone was noticing those. It wasn't just me. So before all of that got any further or more out of control, I decided to go and start estrogen replacement therapy right there.
Kat, were any of these experiences similar to yours?
I started to get hot flashes mostly during the night. Actually, the hot flash was not the biggest problem because it lasted only about 10 minutes. The real problem was trying to get back to sleep at night. I found it extremely difficult to function during the day, especially at work, because I'm the type of person that really needs my sleep.
Whether or not to take ERT is a choice that each of us must make for herself, in consultation with a healthcare professional. And we do it in the same way that we make any treatment decision, by weighing the benefits and the risks. ERT has several effects and will usually relieve menopausal symptoms like hot flashes, night sweats, headaches, and vaginal dryness in a matter of a few days to weeks. Postmenopausal women are at an increased risk for elevated cholesterol. In addition, ERT lowers levels of LDL, also known as bad cholesterol, and increases levels of HDL, the good cholesterol. Transdermal therapy has the same beneficial effects on blood cholesterol as oral ERT after 6 months. Now for the two most commonly discussed potential risks. The first is cancer of the uterus. The second is breast cancer. Let's look at each of these in detail. We know that taking estrogen alone increases the risk of uterine cancer in a woman whose uterus has not been removed by hysterectomy. If you have undergone a hysterectomy, you need not be concerned about this risk. We also know that taking a progestin, a hormone that acts like the female hormone progesterone, along with the estrogen, protects against uterine cancer and can actually reduce its risk to below what it would be if the woman didn't take any hormone therapy at all. There are different regimens for taking progestin. One regimen is cyclical, meaning that progestin is taken for only part of the month. With a continuous regimen, you take a progestin every day. A quarterly regimen involves taking a progestin every 3 months. You and your healthcare provider can decide which regimen is best for you. Depending on the regimen, the progestin may cause monthly bleeding, which we refer to as withdrawal bleeding, because it occurs when the progestin part of your therapy is stopped or withdrawn. Although it may seem a lot like a menstrual period, it's not the same, and it doesn't indicate that you can become pregnant again. Withdrawal bleeding is usually light and not uncomfortable, but if it concerns you at all, you should talk about it with your healthcare provider. You should know that the issue of breast cancer has been researched a lot, with more than 50 studies conducted so far and more in progress, and they haven't all produced identical results. Although ERT has numerous health benefits, it is not right for everyone. If you have a personal or family history of breast cancer, any undiagnosed vaginal bleeding, or any concerns regarding the risks of ERT, discuss them with your healthcare professional. Let me take this opportunity to add, though, that monthly breast self-examination and mammograms as deemed appropriate by your healthcare provider are crucial to the health of all women, whether they choose to take ERT or not. Let's talk next about the ways in which estrogen can be taken. Kathy, can you talk a bit about that?
I'd be happy to. There are basically 4 ways to take estrogen: orally, transdermally, by injection, and vaginally. Orally means that you take the medication by mouth, usually once a day. Another method, transdermal ERT, is becoming increasingly popular for obvious reasons, which we'll talk about. Needle injection is not one of the more popular routes, also for obvious reasons. Vaginally means that you insert a measured amount of cream into the vagina with an applicator. Transdermal means through the skin. The estrogen is contained in a little patch that adheres to your skin, and as you wear it, the estrogen is absorbed through your skin and directly into your bloodstream, bypassing the stomach and liver in a manner that is very similar to the way in which your ovaries delivered estrogen to your body before menopause, and requires smaller total doses than does oral therapy.
Have any of you had the experience of having to switch from one form of hormone replacement to another?
Yes, I had. You know, right after my surgery, I was placed on a pill called Climara. And I did some research article reading on that particular pill, and I understood it had some animal sources in it, and it also went through the liver, which I wasn't too happy with. So I decided with my doctor that we should try something different, and we did. We tried the Estrogen patches. The Estrogen patches didn't do me the best, I thought, and we decided again the new patch, which was Climara, and it was wonderful.
Marcia, how about you? Did you have to switch?
I started on a patch. I started on Estrogen twice a week. And then when Climara came out, my doctor said there's something new on the market, a once-a-week patch. How would you like to try that? You only have to change it once a week. My doctor really knows me because I said, that's the one for me, let's go for it. I want that one.
I also was a twice-a-week changing person, and when those once-a-week patches came out, I switched immediately. I think that the simplicity in taking medicine is really what it's all about.
Pat, how about you?
I too was on Estrogen. Eventually my hot flashes did go away, but I had a real problem with the patch staying on. Sometimes I'd find it stuck to my robe, I would lose it in the shower. I was at the point of trying oral, even though I do prefer the patch. And then I found out about Climara through a friend. So I tried Climara, and it sticks so much better for me. I really love it.
Some women do find the twice-a-week patch changing schedule difficult to remember. That's why a patch is now available that has to be changed only once every 7 days, which actually makes a lot more sense. Climara is a once-a-week patch. Climara estrogen replacement provides smooth, effective levels of estrogen for a full week. Because the patch is applied only once a week and is replaced on the same day each week, most women find it more convenient and easier to remember. The Climara patch contains 17-beta-estradiol, which is the form of estrogen that our bodies produce in the greatest amount before menopause. The estrogen in Climara is natural and derived from plant sources. Premarin is derived from animal sources. This is a Climara patch. You can see it's very small, thin, and clear, but it's extremely effective in relieving menopausal symptoms.
For me, the only thing more convenient than once a week is never. So from that point of view, Climara is just a cinch. I only have to put it on once a week. I have no trouble with it adhering to my wet body. It never falls off. In fact, I forget I have it on.
No more hot flashes. That's the most important thing for me. It's comfortable. It feels good. I'm very happy with Climara, very happy.
I had a couple of reasons why I really like Climara, and one is that I was trying to decide whether I should go 3 days or 4 days. It's supposed to be 3.5 days. Do it in the morning, do it at night. This is just very simple, once a week. But I also like the supporting membrane for the drug. It's very thin, it doesn't crinkle, and it doesn't show up under my bathing suit like the old one did.
Climara is so easy for me to remember. Once a week I change it on Saturday, about an hour after I get out of the shower. And if I have some adhesive left, I use a little baby oil and a soapy washcloth and it removes it.
Let's look at Climara on the skin. As thin as it is, the patch is actually made up of a visible outer surface and the adhesive, which contains the estrogen. The patch is attached to a protective liner, which you peel away to apply the patch to your skin. The Climara patch is actually very easy to apply.
This is really easy, and the longer you do it, the easier it gets. You're going to put the patch on your abdomen or buttock. So the first thing you want to do is choose an area on the buttock or flat part of the abdomen that's clean, dry, and has no abrasions or scratches. Don't apply any powder or lotion to that area because it will make it difficult to get the patch to stick. Avoid the area where your waistband would go because any tight clothing can cause the patch to come loose. Also, don't ever apply it to your breast area. Next, tear open the foil pouch. Don't cut it with scissors because you might damage the patch. Take out the patch and peel 1/2 of the protective liner away from the patch and affix the exposed half of the patch to the skin for 10 to 15 seconds. Then peel off the other half of the liner and press on the entire patch firmly. For optimum adhesion, avoid touching the adhesive with your fingers. Apply firm pressure over the entire patch surface for a few moments to make sure that there are no little air bubbles under the patch. Next, take your index finger and gently rub from the center of the patch out to the edges for 10 to 15 seconds to ensure it is secure and to remove any excess adhesive. That's the whole procedure. You can now forget about menopause and estrogen replacement therapy for an entire week. At the end of the week, you just take off the patch and put on another one. If a little bit of adhesive stays on your skin, you can easily rub or wash it off with a soapy washcloth. When you apply your next patch, alternate buttock sites or choose an area on the abdomen's opposite side. Make sure you don't reapply to the same skin area for at least a week. It's recommended that you change the patch on the same day at the same time each week. Make it part of your normal routine. If you forget to change a patch, though, don't be concerned. Just put on a new patch as soon as you remember and change it on the day you normally would so that you stay on your schedule.
Can I take a bath while wearing the patch?
You can go about your normal routine with confidence.
Actually, a patch falling off happens a lot less often than you might think because Climara is made with a very effective adhesive patented by 3M. In fact, studies show that Climara patches stay on for a full week. If it does happen to fall off, don't reapply the same patch. Put on a new patch and then change it on your scheduled day.
Kathy, what about skin irritation from that glue?
Some women get some irritation and itching, but it's fairly infrequent. You might notice a little redness right after you remove the patch, but it usually fades very quickly. If it lasts more than a few days, mention it to your healthcare provider.
While we're talking about skin irritation, which is what we call a local side effect, we should mention other side effects as well, because they are a part of any medical therapy. With any ERT, some women may notice a little breast enlargement and tenderness, and some experience fluid retention and vaginal bleeding. When these side effects occur, they're usually temporary and disappear in a few weeks. But if any discomfort persists, you should mention it to your healthcare provider. What you shouldn't do is stop using ERT without discussing it with your healthcare provider first. That's because you need more than just short-term treatment in order to get most of the long-term benefits of ERT.
Occasionally, when I remove the patch, my skin is a little irritated, but I just put on some ointment, whatever is close at hand, and that's the end of it.
Well, I have very sensitive skin, and with the old patch, the twice-a-week patch, I really had problems, and I was very sensitive, and I developed, I guess, an allergy. I also get that same reaction to the glue on a lot of adhesive bandages. But now, with the Climara, I have no rashes at all, and that's really important to my satisfaction with this product.
Sure.
Well, I myself, I had no really physical symptoms at all. When I first started to wear the patch, I had a little itch, and it only lasted a second or two. I'm very happy with the patch now. I have no problems. I'm very happy.
I have no problems with Climara. Occasionally I do get an itch, but that seems to go away. And I do work out pretty regularly, and I find that the Climara patch adheres really well, so it doesn't interfere with my exercise program at all.
Well, we put a group of women together and let them talk about menopause, and we could go on all day. However, it's time to wrap up. Using ERT such as Climara is one way to promote your own good health so that you can fully enjoy the many years still to come. Years that really can be the best years of your life.
rising. Change is coming. It's not surprising. Relief is on its way. I believe it's here to stay. Climara. The choice for today. Climara. The choice for today.